Welcome to RSNA 2022. We're here at McCormick Place with the Imaging AI in Practice demonstrations. My name is Ali Tijani, and I'm one of your clinical champions and docents.
My name is Nahan Selena Joe from University of Texas Medical Branch, Galveston, Texas.
Let's join our patient Francine on her journey from her screening mammogram to unexpected trauma, seeing how AI can help us with both her routine and emergent care.
For the purposes of the demo, the images may not line up perfectly because they are actually different patients. The demo will focus on the system which you're used to working with every day. In this case, we're focusing on GE TruePax. Our patient, Francine, starts her morning with a trip to her local breast center for routine screening mammography.
Her mammographic images are required and sent to the GE TruePax for storage. The study is then sent to the GE Edison AI orchestrator, which, as you know, acts as a traffic cop and distributes the study to the appropriate AI algorithm. In this case, our study is sent to the TheraPixel MammoScreen algorithm. The TheraPixel MammoScreen algorithm has identified a finding in the right breast that is suspicious, warranting further workup. Qvera receives this information via DICOM SR, which is then packaged as a fire observation resource and promptly sent to the GE TruePax. Because of the important finding found by the TheraPixel MammoScreen algorithm, GE TruePax gives this exam a higher worklist priority. And note that the patient has been prioritized to the top of the reading work list because of the AI findings. As you can imagine, our breast center strives for excellent care, and so when a screening mammogram is flagged to be suspicious, our radiologists review them as soon as possible. And in this case, we pull up our images specifically in the Fovea AI cockpit viewer for evaluation. The AI results that you see here are coded behind the scenes using a system called the Radiology Lexicon, or RADLEX, developed by the RSNA. This allows all of our systems involved in the radiology workflow to understand exactly which piece of information is shared. The systems you see here support the mammography CAD DICOM structured reporting, or SR, standard to be able to exchange the AI results with other systems. Just a reminder, this is an international standard that you should be requesting in every RFP you write. In the case of our study, we see the following findings. There are 2 false positives considered to be BI-RADS 1 and 1 true positive that needs further diagnostic evaluation, in this case, labeled BI-RADS 0. Note the confidence score along the bottom of the screen, indicating the algorithm's concern for benign or malignant findings. Again, given that this is a screening mammogram, radiologists can choose to incorporate this asymmetry on the right CC view image as BI-RADS 0 to further work up this finding. Also note that the SR format allows radiologists to actually scroll through the corresponding tomosynthesis images before deciding upon accepting or rejecting AI results. Our mammography radiology template is then autofilled, completed, and signed in the Smart Reporting interface. The radiology report is then sent to the Qvera interface engine, where it's then distributed to the electronic medical record and other systems, or even used as an AI label for future AI algorithm development. A quick aside here about Qvera. Many people probably know that these systems speak standards like DICOM, HL7, and FHIR. The Qvera interface engine acts as a translator between these standards to ensure that all systems can communicate effectively and make sure that everything works. For example, Qvera can convert DICOM SR results into FHIR, so the data is understood in both the PACS and the EMR. But back to our patient. Our radiologist reviews the images with her and recommends additional views for confirmation and a possible ultrasound. Francine has to return to an important meeting at work the same day, so she schedules to return to the breast clinic the next morning and leaves the breast center with anxious thoughts.
Once the report is finalized, the patient receives an email alert that the report is now available. Instead of returning to the hospital to pick up a CD for her imaging, Francine logs into her Pocket Health, where her medical imaging and radiological report has been automatically uploaded. As you can see, Francine clicks on the email link that brings her to the portal. She can select reports and images To review, Francine does not have background in medicine. Pocket Health provides patient-friendly tool called Report Reader that defines complex medical terminology to a layman's term. Now, she can share the images with her husband and also discuss in detail with her daughter, who is a doctor. Having access to her imaging makes her feel more involved in her own healthcare. The next day, unfortunately, Francine got involved in a car accident. She is transported to a trauma center where they obtain an emergent non-contrast CT head and a portable chest radiograph.
The portable chest radiograph is sent to the GE Edison AI orchestrator, which forwards the image to the Siemens AI Rad Companion AI system, where the algorithm detects a left pneumothorax. As a quick aside, AI orchestrators, such as this one, operate based on a decision tree that allows them to appropriately direct studies to the desired AI algorithm. In our case, the pneumothorax results are sent to the GE Edison orchestrator in a DICOM SR that complies with the IAIP AI results profile, an international standard for AI results reporting. After an AI prioritization message from the GE Edison orchestrator to the PACS, our patient is again at the top of the work list, this time due to her pneumothorax. Note that you can tell on the work list that this case has a higher priority. This time, it was the Siemens AI Rad Companion, which detected the ACR Category 1 finding to modify the work list. The radiologist accordingly quickly confirms the left pneumothorax. The radiologist calls the ER physician to relay the critical findings. Once an emergent chest suit is placed, the patient is sent to the CT suite for a CT scan of her head. Again, our GE Edison AI orchestrator is hard at work sending the CT images to the QER AI algorithm for analysis. This algorithm performs assessment for intracranial hemorrhage, infarct, cranial fractures, mass effect, and midline shift. Note that the viewer displays an interactive DICOM SR version of the AI results for radiologist review directly in the PACS. So here we see that the algorithm has detected 3 findings: intraparenchymal, subdural, and subarachnoid hemorrhage. We'll take a look at these findings in the Fovea AI Cockpit viewer to accept, reject, or modify our findings. We'll take a look at the subarachnoid hemorrhage first, and it looks like this may actually represent calcifications of the choroid plexus. We'll go ahead and reject these findings. Now here we see a subdural hemorrhage that's quite subtle, but we identified it thanks to our algorithm's aid. However, it looks like the finding is measured longitudinally. Let's modify this to make sure it reflects the thickness, as we often monitor in clinical practice. Finally, we see an intraparenchymal hemorrhage in the right frontal lobe. We'll confirm this finding and accept the volume. Here we see the Smart Reports system automatically populate our report with confirmed findings and measurements, thanks to consistent use of standards like RADLEX. Note the interactive component that allows radiologists to adjust findings, such as the location of the intraparenchymal hemorrhage.
You may have noticed that all these different applications, including PACS, image viewers, and reporting, open correctly to the same patient. This is possible using Firecast. Firecast is not the same thing as Fire. Firecast coordinates applications to look at the same patient securely. Firecast, in short, is a standard that synchronizes clinical applications, EHR, PACS, reporting system, and AI tools to a given study or patient. Upcoming versions of Firecast will also enable exchange of measurements and AI findings.
Because the AI results are coded in the RADLEX lexicon and other coding systems, the AI results are easily and automatically populated into the report template. Again, none of these measurements or observations were dictated by the interpreting radiologist. Also, note that although the AI algorithm identified multiple findings in the initial results presented to the radiologist on PACS, only a subset of those were mapped into the actual final report and presented to the ordering physician, based on specifications provided by the radelements.org CDEs. Note the difference in paradigm here. In this case, the radiologist may modify AI results in the final report if they choose to do so at all. Another deserved shout out goes to the OrThank server, an open source, free to use PACS VNA implementation. Tools like OrThank are helpful on their own, like in small clinics, or when augmenting commercial products, such as last mile integrations or even as a PACS instance for research projects. In the case of this demonstration, we used OrThank to bring results produced in the cloud back to the on-premises network.
We hope that you consider the following takeaways. The architecture of the overall system for your hospital is critical, requiring international standards such as IHE, DICOM, HL7, or FHIR will enable interoperability of different AI softwares, as you can see on this showcase. Requiring structured, coded semantic systems, such as RADLEX, LONIC, and SNOMED, will make the AI and other data flow through the system. Specifically, in this demonstration, we showed you AI not only assist in mammogram finding detection, but also prioritize, assist in patient understanding of radiology reports, automated creation of reports incorporating AI results, without tedious job of measuring and dictating the measurements.
But how do you know if AI is improving workflow at your institution? You use the IHE Standardized Operational Log of Events, or SOL profile. This allows precise measurement of activities in your department. You can see graphs over time monitoring SOL in the prostate cancer workup team. For this demonstration, nearly all systems are sending SOL events. And finally, you need to ask for all of these in every RFP for every system.
Thank you for joining us in Imaging AI in Practice clinical demonstration. We hope to see you all in RSNA 2023.